Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Today we are talking about Z codes. Z codes. In my previous videos I said with medical coding we code what's wrong with the patient, right? I stress don't go to the body part, go to what's wrong, and that's what we identify. But what happens if you go to the doctor or to the hospital and nothing's wrong? Your visit's free, right? No, but because you're encountering healthcare services, physician still has to see you, then there is a code that we need to assign to get reimbursed for services or resources used. So, what main terms do we look up to identify that nothing's wrong with the patient? There are seven. Seven key main terms to look in your alphabetic index for Z codes that identify nothing's wrong. One is admission, examination, history, observation, aftercare, problem, or status. Seven main terms, key main terms that we look up. Admission, examination, history, observation, aftercare, problem, and status. Okay, those are main terms that will help you identify terms to identify when a patient uses resources or comes to the hospital and no medical diagnosis is found. So, when is a Z code? And all these will lead you to a Z code. So when are Z codes used as the principal or first listed diagnoses? Well, there are four cases. One, to indicate that a person with a resolving disease or injury or a chronic condition is being seen for specific aftercare, such as removal of an internal fixation device like orthopedic pins. They no longer have the acute condition. It's healed and now it's time to remove the pins. So in a case like that, orthopedic pins removal or aftercare, that would be your first listed diagnoses. Or to indicate that the person is seen for the sole purpose of special therapy, such as radiation therapy or chemotherapy. When a patient has cancer, for example, and they're coming in for chemo or radiation, that chemo or radiation becomes your first listed diagnosis when that's the reason for the admission. What about to indicate the person who is not currently ill, but they are coming for healthcare services for a specific reason, such as to act as an organ donor, prophylactic care, or to receive counseling? Think about it, those three situations. An organ donor, what's wrong with them? Usually nothing. Matter of fact, they're usually in such good health that they can donate their organs. Prophylactic care. A lot of times patients come in for prophylactic care because they need that medication, that form of procedure to prevent the disease process from happening. And then counseling. A lot of times due to a patient's lifestyle, it can lead to a disease process. So patients are brought in for counseling so that we can educate them to prevent a disease process from coming on, if that makes sense. Okay? And then the fourth would be to indicate the status of a newborn. When a mother comes in and has her baby, we have a mother's chart and a baby's chart. Well, the mother delivered and had her baby, and the baby was a healthy newborn. So what's wrong with the baby? Nothing. So we have to indicate the status of this newborn as a healthy, live-born infant, and that's a Z code. Those are the four situations when a Z code would be the principal diagnoses. All right, so when is a Z code assigned as an additional diagnosis? Two situations. One, to indicate the patient has a history, a health status, or another problem that is not in itself an illness or an injury, but influences the patient's care. For example, personal history of malignant neoplasm. You had a history of it. Today you're just coming in to make sure or to get screened or to get checked to see whether or not it's come back. Or you have a personal history of another type of disease, not malignant neoplasm, but some other type of disease, and you're coming back in today to see whether or not you're still in remission, or has it come back, or what's going on with it, okay? Or in the case of a family history, if your family has a history of a condition and it's been known to be genetic and passed down, and people in your family are getting it, and you just want to come in and get checked out. And then to indicate the outcome of a delivery on the mother's chart. So again, the mother comes in, has her baby. We also need to identify, what did she have? A single live born, triplets, etc. So the outcome of what she has, we identify on the mother's chart. So in those cases, the Z code is used as an additional diagnosis. All right, let's go back to the admission for the encounter for aftercare management. Aftercare visits codes are assigned under codes or category Z42 through Z51. And as I'm going through some of these codes, you guys look in your code books with me so that you can see them. You might want to make notes in your book. But at categories Z42 through Z51, those aftercare visit codes, they're used when the initial treatment of a disease has been completed, but the patient requires continued care during the healing or the recovery phase, or for long-term consequences of the disease. So again, these are aftercare. It's not in the acute phase. The aftercare code is not assigned when the treatment is directed at the current acute disease. When the diagnosis is a current injury, you'd be over in the other part of the alphabetic index for current disease or injuries. But for aftercare, you'd be over in the Z's. The exception to this is an encounter for anti-neoplastic chemotherapy and immunotherapy, Z51.1 and Z51.0. When encounters for the purpose for more than one type of anti-neoplastic therapy, a patient's coming in and getting chemo and radiation, which one do you assign first? Either one, as long as you identify that the patient's getting both. So you assign both codes and either one can be sequenced first. Palliative care. What is palliative care? Palliative care is an alternative to an aggressive treatment for patients who are in the terminal phase of an illness. Care is focused on the management of pain and other symptoms of the disease, which is often more appropriate than aggressive care when a patient's dying of an incurable disease. So code Z51.5, Encounter for Palliative Care, is used to classify admissions or encounters for comfort care, end-of-life care, hospice care, and terminal care for the terminally ill patient. Okay? Aftercare Z code should not be used if the aftercare is for injuries. Because remember, for aftercare of an injury, that's assigned at that code in the alphabetic index with your 7th digit. We talked about a sequela and residuals and all of that in the previous late effect chapter. Well, that 7th digit, D or G or K or P, will identify aftercare for an injury such as a fracture. So that's not in the Z code categories. Aftercare codes are generally listed first. When you're coding, they're generally listed first to explain the specific reason for the encounter. They can be used occasionally as an additional code when the aftercare is provided during an encounter for treatment of an unrelated condition, but no applicable diagnosis is available. For example, if a patient has a motor vehicle accident, and aftercare, while they're in for that motor vehicle accident, the patient has a colostomy bag, and the physician sees no reason to continue to hold on to that colostomy, and they decide to close off the colostomy bag. Well, the aftercare code should be used in conjunction with the aftercare diagnosis that they're brought in for, just to identify the fact that while that patient was in, the colostomy bag was closed off. The sequencing of multiple aftercare codes depends on the circumstances of the encounter. Certain aftercare Z codes need a secondary diagnosis to describe the resolving condition or sequela. Others, the condition is included in the code. When a patient is admitted because of a complication of a previous care, the appropriate code from the main classification is assigned rather than an aftercare code because, again, they had a complication. So that takes you out of the Z and into the actual alphabetic index to other diseases. All right, what about follow-up examination? Follow-up. A code from category Z08, Z09, and Z39 are assigned as principal diagnoses or the reason for the encounter when a patient is admitted for the purpose of surveillance after the initial treatment of a disease or an injury has been completed. Because look at code Z08. Z08 says encounter for follow-up examination after completed treatment of a malignant neoplasm. Okay? Z09 says encounter for follow-up examination after completed treatment for conditions other than a malignant neoplasm. And Z39 says encounter for maternal postpartum care and examination. Because think about it. After the woman has her baby and she goes home and she's required to come back in for that 6-week checkup just to make sure that she's healing up and everything looks okay. Well, when she goes back at that 6-week checkup and nothing's wrong, what do we code? We're in the Z39 category there. Okay? She's healing up. Now, if a reoccurrence or an extension or a related condition is identified, the code for that condition is assigned as the principal diagnoses rather than a code from Z08, 09, and Z39. So think about it. We'll bring them in for follow-up care after a malignant neoplasm, other disease, or postpartum care. But if they come in for that and something else is found, we come out of the Z and we go to that in the index to disease, because then it becomes a disease process that we're actually going to code. It's no longer a Z category code. All right, what about admissions for observations and evaluations? A code from category Z03, encounter for medical observation for suspected disease and condition ruled out, or category Z04, encounter for examination observation for other reasons, is assigned when a person without a diagnosis is suspected of having an abnormal condition without sign or symptoms, which requires study, but after examination observation, it's ruled out. Okay? Category Z03 and Z04 are also used for the administrative and legal observation status. Outpatient referrals for surveillance or for other diagnostic studies, Z04, Z03 can also be used for those. The observation codes are not used if an injury or illness or any signs and symptoms related to the suspected condition are present. In that case, you code those signs or symptoms. Okay? And then they single out observation or suspected condition of a newborn. Instead of using Z03 and Z04, we'd use P00 through P04 for a newborn. Okay? A code from code Z71.1 is used for persons with a feared complaint in whom no diagnosis is made. And y'all, we do have those. We have what we call worry wells. These are patients that worry all the time, and they worry that they have this disease process. They have no signs or symptoms, but they just know they got this disease. I don't know whether they heard it on TV, read it on the internet, or what, but they have no signs or symptoms of it, but they just know that they have this condition. That's a Z71.1 when doctor checks them and they don't have it. Okay? Now, if they do have it, you code that. But in the case when they just worry about it and the doctors check them out and there's nothing wrong with them, that's a Z71.1. All right? A code from category Z03 and Z04 can be assigned only as the principal diagnoses. So you might want to write that in your book if a note is not already there. Z03 and Z04 can only be assigned as the principal diagnoses or reason for the encounter. It's never used as a secondary diagnosis. And a code from category Z03 and Z04 are normally solo codes. They're usually the only code that's assigned. However, there are two exceptions. One is when a patient has a chronic condition that requires monitoring during a stay. For example, they're bringing them in to observe them for a suspected condition that's not found. Oops, they also have diabetes. And you know, with diabetes, you have to continuously monitor the blood sugars. You may have to administer insulin. So when they have a chronic condition that requires monitoring or observation while in for the other suspected condition, that's when the Z03004 may not be used. It might have an additional code along with it. Or when the admission is for the purpose of ruling out a serious injury, such as a concussion. Say the patient had a car accident and they suspect that the patient has a concussion. And while they're checking the patient for the concussion, they notice that the patient also has abrasions and contusions, and they take care of those while the patient's in. After study, they find out the patient does not have a concussion. It would be in that Z03, Z04 category, and then we'd also assign a code for the abrasions and the contusions if those were treated while in. Okay? You also have ER visits where law enforcement refers a patient in for a suspected mental disorder, trying to justify what could be wrong with this patient to do or commit the crimes that they've done. And then if none is found and no other condition is identified, category or no code Z04.6, encounter for general psychiatric exam requested by authority, is assigned. So there is a code Z04.6. All right, let's talk special investigation. When a patient receives only diagnostic services during an episode of care, a code for the condition or problem that was chiefly responsible for the encounter is assigned. A code from category Z01, encounter for other special examination without complaint, suspected or reported diagnoses, is assigned as the reason for the encounter only when no problem, no diagnoses, or no other condition is identified as the reason for the admission or the examination. A separate procedure code is required to identify any type of examination or procedures that may be performed. And codes from category Z01 are rarely appropriate for inpatient codes, okay? Remember, inpatient, they're bringing you in, they're doing studies, they're going to find out what's wrong or what's causing the signs or symptoms. What about screening exams? What's a screening exam? Look at codes Z11 through Z13, encounter for screening. Those are assigned for encounters for tests performed to identify a disease or disease precursors for the purpose of early detection and treatment for those who test positive. Screening is performed on apparently well individuals who present no signs or symptoms relative to a disease. And a screening mammogram is an example of such a test. And if in a screening mammogram or some type of exam identifies pathology, then the reason for the test, Z0 or Z11 through Z13, is assigned first. And then whatever pathology is. For example, a woman comes in, we tend to have mammograms done once every 5, 10, or yearly, okay, depending on your circumstances. Well, if you are a previous candidate of breast cancer, you've gone through your chemo, radiation, or whatever, and now you're just coming in every 5 years for your screening examination, then you'd be in that Z11 through Z13 category of codes, and then, because you don't have any symptoms today, and then as they do that screening, oops, they do find the malignant breast cancer again, you do that Z11 through Z13 code first for screening, and then you'd identify the fact that, yep, patient does have the neoplasm back in the breast again. Okay? What about codes representing patient history, status, or problem? Codes from category, let's see what category, Z85 through Z92 are used to indicate a personal history of a previous condition. When the condition mentioned is still present or still under treatment, or if a complication is present, a code from that series of codes is assigned and not a code from Z85 through Z92. Category Z80 through Z84 indicate a family history of, not a personal, a family history of, and may be assigned when the family history is a reason for the examination or the treatment. Status codes indicate that the patient is a carrier of a disease. They have a sequela or a residual of a past disease or condition, or has another factor that's influencing his or her health status. Okay, look at categories Z88 through Z99. They indicate that a patient has a continuing condition or health status that may influence care, such as the fact that they may have a tracheostomy. Tracheostomies have to be cleaned out. Colostomy, the bag has to be changed. What about a cardiac pacemaker or aortocoronary bypass graft? All of these are status. They're there. They may require care. They may not. Z codes indicating status are redundant when the diagnosis code itself indicates the status exists. So when the patients have these tracheostomy, colostomy, pacemaker, or whatever, we tend to use a status code if it has a bearing on that stay. But what if the diagnosis for this particular stay indicates the status already? It would be double coding. For example, if we have a patient that has a rejection of a kidney transplant, that code is T8611, and it says kidney transplant rejection. Well, that already indicates that the patient has or is status kidney transplant. So we don't use the status kidney transplant with that code T8611 because it already identifies the fact that the patient has a kidney transplant. Hope that makes sense. A diagnostic statement expressed as status post most often refers to an earlier surgery or injury or illness, and it usually has no significance for the episode of care. And so no code should be assigned for the condition if it does not have a bearing on this particular patient's visit. Now we hear people that, oh, they are status post to C-section 15 years ago when she had her baby. Well, today she's in for a hip replacement. That has nothing to do with this stay, therefore we don't even code it. So make sure you know the difference between history and status. History codes indicate the problem no longer exists. Status codes indicate that the condition is present, but as a coder we determine whether it has a bearing on this admission. Codes from Z79 are assigned to indicate a patient's continuous use of a prescribed drug for the long-term, notice I said long-term treatment of a condition or for prophylactic use. An additional code is assigned for conditions for which the medication is prescribed. Do not assign a code from category Z79 when the medication is prescribed to treat an acute illness or injury and is being given for a brief period of time. This category is not used when medications are given for detox, maintenance programs used to prevent withdrawal of symptoms in patients with drug dependence. So when do you use Z79? Diabetics who are on insulin. That's going to be a long-term process. So we do use the Z79. Blood thinners. Patients who have heart condition and they're on blood thinners, that's a long time type of drug therapy. So we'd use a Z79 on that. But if it's just for an acute illness and they're on some medications, we don't use category Z79. And again, if it's for maintenance or for drug dependence or withdrawals, we don't use category Z79. So I hope I explained that. All right, guys, that's Z codes. I put together a lesson plan. It does include late effects, the previous video we had, and then Z codes. And so I've got some exercises for you to code and along with the answer key. So if you're wanting that, that's volume 4. Be sure to email me at Codemastercoach and request volume 4 for the lesson plan that lists these same guidelines that I covered in this video, along with some exercises and an answer key so that you can practice coding late effects and Z codes. Okay guys, that's it. Thanks, and I'll see you in the next one.